Good morning. Thank you all for being with us. My name is Philip Vann, and I am the chairman of the Board of Directors for Children's Trust of South Carolina. We've gathered here this morning to share with you the results of an economic study created by Dr. Joseph von Nessen, research economist at the University of South Carolina's Darla Moore School of Business. This study was commissioned by Children's Trust and funded with donations from partners, including the Annie E. Casey Foundation and Prevent Child Abuse America, along with financial contributions from Children's Trust board members. I sincerely thank them for all their support. Beyond the immeasurable human toll, the economic cost of child abuse ripple through families, communities, and our state. Our purpose in undertaking this effort was to, in some small way, quantify those costs and demonstrate how proven prevention programs can pay off for children, families, communities, and the future of South Carolina. The results of Dr. von Nessen's study are sobering and prove that the time is now for us to invest in the prevention of abuse and neglect. We appreciate Dr. Joey von Nessen's work on this report, and I welcome him to the podium to share his findings. Thank you.
Well, good morning, everyone. My name is Joey von Nessen. I am a research economist with the Darla Moore School of Business here at the University of South Carolina in Columbia. And I, too, want to thank everyone for coming out today and for the invitation to participate in the debut of this new study documenting the significant economic losses that result from child abuse and neglect in South Carolina, as well as the potential benefits that can be realized from prevention and intervention efforts. Child abuse and neglect is unfortunately a serious problem in South Carolina. Just in the last 12 months alone, more than 13,000 children have been part of substantiated investigations of abuse and neglect, and an average of 250 children in South Carolina die each year from preventable deaths. Now, the greatest losses associated with child abuse and neglect are, of course, impossible to quantify, and those are the ones associated with the loss of life and, of course, the associated loss of human potential, dignity, and liberty. But there are also economic costs, which is what we quantify in this study in an effort to better understand the widespread consequences that often occur. In this study, we specifically measure child abuse and neglect through the incidence of what is known as an adverse childhood experience, adverse childhood experiences, which include not just the direct experiences of violence, abuse, and neglect, but also indirect experiences, things like an unstable home life that can result from witnessing violence among other family members or having a parent with substance abuse or mental health challenges. Specifically, child abuse and neglect, as measured by adverse childhood experiences, typically leads to three primary negative economic consequences that we identify and examine in this study. The first is the loss of earnings or wages among victims. Childhood victims of neglect, sexual abuse, and physical abuse are found to earn on average about 14% less as adults. And this can occur for a variety of reasons, ranging from educational disruptions and higher dropout rates to difficulties in forming stable relationships and the ability to build trust, as well as the implications for job losses and frequent job changes. And all of this can have an impact on job performance, productivity, and ultimately an individual's earnings. Second, and related to the first, is workplace absenteeism. Adults who experience at least one adverse childhood experience miss 2.5 more work days on average per year, and adults who are frequent victims of child abuse report twice as many workplace absences due to mental health conditions such as anxiety, depression, and an inability to cope with stress. Increased absenteeism, in turn, reduces the number of hours worked and often further decreases the earnings of victims. And third, we also look at increased medical costs. Childhood trauma, and especially repeated trauma, can increase stress levels, which can lead to a variety of specific types of chronic health issues and harmful coping mechanisms. And to give you an example of this, surveys have found consistently that adverse childhood experiences significantly increase the likelihood of depression, of heavy drinking, and of smoking. But by contrast, there is no significant relationship between adverse childhood experiences and outcomes like arthritis, cancer, and diabetes. So we can see a very direct connection to specific types of chronic health challenges associated with adverse childhood experiences. And the American Medical Association estimates that the economic burden of health conditions related to adverse childhood experiences, as measured by direct medical spending, is about $1.7 billion annually just in South Carolina alone. So when taken together, when we look at all three effects of the lost wages, of increased medical expenses, and of workplace absenteeism, the collective direct impacts total $45.7 billion in annual economic losses in South Carolina. Yet these losses extend far beyond just these direct effects. We also have to take into account secondary economic losses, sometimes referred to as the multiplier effect, that come about as a result of these direct effects. So as an example, consider that when household spending levels decrease in a local community due to wage losses, that leads to a declining demand among local businesses, which in turn generates additional economic losses as the day-to-day business operations pull back. Higher workplace absenteeism can also lead to lower business productivity and business output over time. And in this study, we estimate that these secondary economic losses sum to more than $28 billion annually in additional economic losses on top of the direct losses that we just mentioned. And so we combine the direct effects as well as these secondary multiplier effects. We see that the total annual economic losses associated with child abuse and neglect in South Carolina exceeds $74 billion annually. $74 billion annually. This reflects the economic losses tied to approximately 2.6 million adults in South Carolina that have experienced one or more adverse childhood experiences. Now, it's also important to recognize that these losses extend statewide. This is not necessarily concentrated in one area of the state or another. It extends to all 46 counties, and the results reveal that child abuse and neglect truly is a statewide challenge that affects rural and metropolitan areas relatively equally, especially when we examine the incidence of repeated child abuse and neglect. Approximately 57% of all adults in South Carolina experienced at least one adverse childhood experience during their childhood, with this percentage ranging from anywhere from 47 to 64%, depending on the county. The counties overall with the largest annual losses are Greenville, Richland, and Charleston, but simply due to the fact that they sit within three of the major population centers of South Carolina. Approximately 21.5% of adults in South Carolina, or roughly 869,000, report having experienced four or more adverse childhood experiences during their childhood, which from a national perspective ranks South Carolina 21st in the U.S. in the incidence of repeated childhood abuse and neglect. So consider 869,000 with four or more compared to the 2.6 million with one or more. However, having said that, small improvements can have major benefits over time. If South Carolina were to decrease the number of adults with four or more adverse childhood experiences by just 21,000 from additional prevention and intervention efforts, this would likely generate $342 million in annual economic benefits arising from fewer losses associated with lost earnings, medical costs, and workplace absenteeism. Further, a decrease of 130,000 would generate $2.1 billion in annual economic benefits, or more than $21 billion over a 10-year period. So again, small investments can have major impacts. So to sum up, we can clearly see that child abuse and neglect impose enormous costs on South Carolina, including very specific economic costs that we can quantify. The study estimates $74.2 billion in annual economic losses, both direct and indirect, spread across all 46 counties, resulting from lost earnings, workplace absenteeism, and medical costs. Thus, future investments in prevention and intervention efforts can lead to healthier children and adults, stronger communities, and a more prosperous economy for South Carolina. Thank you all very much.
Good afternoon. My name is Mike Reichenbach. I'm the senator from Florence County, District 31. I also serve as vice chair of the Joint Committee on Children, as well as the chairman of the Senate Subcommittee on Child Welfare. I often take real pleasure in press conferences like this when we get to announce things like job opportunities or economic development projects. This is a sobering occasion when we talk about what's at stake here. Dr. Van Nessen did a great job on explaining the $74 billion impact to the state. $74 billion. But the numbers don't tell the whole story, as he mentioned. The lives that are changed, the moral imperative that we have as a society, as a General Assembly, as a community, to look out for those who are not able to look out for themselves right now. This is a situation that if it doesn't change and if we don't involve Children's Trust and other organizations to start turning this tide, generations will be lost. It's that important, even beyond the $74 billion. It's important to the state, it's important to our economic development and to our workforce, to the consumer base, to the employee base, but there are lives at stake here. And I'm grateful for what Children's Trust is doing to stand in the gap and to spread the word that we should do more than try to pluck people out of the river when they're already downstream. How do we stop them from ever falling in the river? And that's a metaphor that I hope we all remember, because that's what's at stake right now. I'm now going to introduce Representative Paula Rawl Calhoun, who's the chair of the committee in District 87, Lexington County.
Thank you, Senator. Good morning. My name is Paula Rawl Calhoun. I live in Lexington. I serve District 87 in the South Carolina House of Representatives, and I'm here as chair of the Joint Citizens and Legislative Committee on Children. The Joint Citizens and Legislative Committee on Children takes a comprehensive look at the issues affecting children and families in South Carolina. Our role is to bring policymakers, agency leaders, and child advocates together to identify solutions and translate them into policy and legislative recommendations to the governor and the General Assembly. Each year, we release 2 major publications with the findings. These tools give lawmakers, agencies, and communities a shared foundation for understanding where progress is being made and where the needs are greatest. The work of the Committee on Children complements the work of the Children's Trust of South Carolina, which leads the state's efforts in the prevention of child abuse and neglect. Their report today demonstrates that investing in prevention has both a human and economic return. Fewer children experiencing trauma, better health outcomes, and a stronger, more stable workforce. The findings in this study reinforce that we see through our own research and public hearings that when families are supported early, children thrive, communities stabilize, and state resources are used more efficiently. Prevention is proactive policy. It's about building conditions where children and families succeed before crises occur. The economic cost of child abuse and neglect, an estimated $74 billion annually, reminds us that early investment in prevention programs is not just compassionate, it's fiscally accountable. When we strengthen families, we also strengthen South Carolina's economy. More young people are prepared to enter and remain in the workforce. Fewer children enter the juvenile justice system. Schools and communities are safer and more stable. These outcomes benefit every South Carolinian. We've talked about ACEs, but I just want to say that this is a tremendous tool that we need to continue to educate South Carolinians about. Those that work in this area understand this measuring tool called ACEs, Adverse Childhood Experiences. But we need to educate more folks about this potential measuring tool that is providing so much information about early childhood and how we can use it for prevention. Prevention leads to better outcomes for everyone, more young people prepared for the workforce, fewer entering the juvenile justice system, and stronger, safer communities statewide. Addressing child abuse and neglect is a shared responsibility, one that requires collaboration among state agencies, nonprofits, local communities, and legislative partners. The committee's work and the work of the Children's Trust are aligned, both focused on helping each other in South Carolina grow up safe, healthy, for every child in South Carolina to grow up safe, healthy, and with the opportunity to reach their full potential. Thank you. And at this time, I'd like to introduce Richland County Sheriff Leon Lott.
I stand here representing law enforcement, and child abuse and neglect is something we see every day. These numbers the study showed should be a shock to everyone, because I don't think people realize that. The economic impact, and I know those who work in this building, our legislators, they're always looking at the money factor and how it impacts negatively our state. But I don't know if you can put a price tag on pain and suffering. And that's what we see. One of the hardest cases that we have to deal with in my profession is when a child's been abused or a child's been neglected. We see it too often. We see the cycle that it causes. When a child has been abused and neglected, and that child grows up, and they have children, and those children are going to be abused and neglected too. That is a cycle that we need to break. That is a cycle, once we break it, then we'll have a generation that these numbers will not be anywhere close to what they are now. And it's all called about being proactive. Unfortunately, we do a lot of reacting. That's what we do. In my profession, we have to react when someone's been abused or someone's been neglected. Enforcement is a part of it, but that's not the key. The key is education, and the key is preventive programs. And what I'm excited about is seeing Children's Trust and all of us here today forming one team with one goal, and that is reduce child abuse and neglect. TEAM, together everyone accomplishes more. And when we can do that as one team, then we are going to be very effective. So today is a very encouraging day. These numbers are very sobering and shocking. For those who count numbers and see how high it is, I hope they understand that is human beings we're talking about. It is not just a number. That is a child somewhere in our state who is suffering today. And as the senator said, we've got to do something about it. We have to do it now. We can't wait till tomorrow or next week. Every minute that we wait, that's a child that's being abused or neglected. It's up to us. We have to be their voice. We have to be the ones that stand tall for these children who do not have a voice and who can't stand up. That is us. We have to do it. So it's my pleasure and honor to stand here as part of this team. We're committed to do what we can, not on the enforcement part, but on the preventive part. It takes a team, and we're a team. Thank you.
Good morning. I'm Dr. Martha Edwards, president of the South Carolina chapter of the American Academy of Pediatrics. There's a quote that I think about a lot, and it's attributed to Fred Rogers, and it goes like this: "Not every child goes on to become an adult, but all adults were once children." Fred Rogers' words remind us that childhood is the foundation of every adult life, and that when that foundation is shaken by abuse or neglect, the cracks can last for generations. Today's report confirms what pediatricians have long known. Child abuse and neglect don't just harm children in the moment, they change the trajectory of their health for a lifetime. Children who grow up with repeated stress, fear, or violence experience lasting changes in their developing brains and bodies. Neuroscientists estimate that babies form over 1 million connections per second. These connections are shaped by the baby's environment and experiences. When these experiences are positive, the brain builds strong pathways for learning, emotional regulation, and trust. But when children live in fear or instability, the result is a brain that's wired for survival, not for growth, one that carries the marks of trauma well into adulthood. We see higher rates of heart disease, depression, substance use, and even early death. These experiences literally get under the skin, affecting immune function, hormone balance, and brain development. The consequences of child abuse and neglect are not limited to childhood. They're carried in the clinics and clinic exam rooms, emergency departments, and counseling offices of every community in our state.
I'm Dr. Ramkumar Jayagopal, and I'm the Vice President for the South Carolina AAP. I just want to reemphasize what she said. The consequences of child abuse and neglect are not limited to just childhood. They're carried into the clinic rooms and then the emergency departments, and they show up as an adults, and they have a lot of health issues, higher rates of drug, heart disease, including cancer. So as pediatricians, we know that prevention is more powerful and cost-effective than repair. That's why the South Carolina chapter of the AAP stands with partners across the state to strengthen the families before crisis occurs through home visiting programs, parenting support, and community-based family resource centers. Our call today is very simple but urgent. Invest in prevention as the most powerful form of public health. By supporting families early, before the trauma begins, we can reduce emergency care costs, long-term treatment needs, and state healthcare spending. So how we care for our children today will determine the health and success of our communities tomorrow. Thank you. I'd like to introduce Sue Williams. She's the CEO of the Children's Trust, to say the final words.
Thank you to all of our speakers and our additional supporters here today. Thank you for standing with us, Senator Reichenbach, Representative Rawl, Sheriff Lott, and Dr. Edwards. I also want to thank Senator Tom Young. While he's not here today because of a scheduling conflict, he did offer his support and asked to be included in our press release because he cares as well. We appreciate you and truly value your partnership in this work. We have talked about what it costs when South Carolina fails to prevent child abuse and neglect, both in human terms and in economic impact. I appreciate what our speakers have shared to bring some of this to life today. Higher medical costs, more missed days at work, and lower lifetime earnings. These losses affect every corner of our state, including both rural and urban counties. Our state leaders have done an excellent job of attracting record-breaking economic development investments over the decades in South Carolina. Michelin, Boeing, Volvo, Scout, and many more. We now ask state leaders to stand with us, invest in the next generation, our future workforce. Invest in prevention to ensure that we have the workforce we need in the future and to help us sustain these gains. This study shows us the power of prevention. This is helping families before the crisis happens, so when it does, they have built the resilience and know how to manage it together. If South Carolina can modestly improve the number of children in this state who experience direct and indirect abuse and neglect, it could generate $21 billion in statewide economic impact over the next decade. And we already know what works. Children's Trust has spent over a decade testing programs, evaluating programs, and we know what works. Programs like home visiting, the Strengthening Families program, the Positive Parenting program, and our network of family resource centers have been proven to strengthen families, prevent abuse, and reduce long-term costs. But these programs need sustainable, reliable funding to reach more families across our state. More than 41 years ago, the legislature turned the vision of a statewide prevention organization into reality. Today, we ask you to help fully realize that vision by funding the Trust Fund. To reach more families, in need of prevention services, we need a self-sustaining funding source that supports infrastructure, staff capacity, and the oversight necessary to deliver proven programs at scale. With that foundation in place, every contribution, contract, and grant can go directly to services, maximizing impact, ensuring accountability, and providing children and families the best possible return on investment. Funding the trust fund is not overhead. It is how we make sure help reaches the families who need it the most. We urge our state leaders to take action by making a one-time $10 million legacy investment into the Children's Trust Fund to ensure the long-term stability of prevention funding in the state, along with a $1 million recurring allocation to expand programming efforts. This is an investment in children, an investment in the future, a future where strong families are the backbone of our society and drive our economic engine. This is an investment in South Carolina's workforce, economy, and prosperity. Every dollar spent on prevention saves lives, strengthens communities, and returns value to taxpayers many times over. We thank Dr. Von Nessen and the University of South Carolina for helping us prove the case that prevention is an economically sound investment that can reap a significant return for all sectors of our great state. Thank you all so much. I appreciate it. Thank you. Thank you.